Thank you, Chair. So we're going to move on to food advertising and regulations. So we're going to start with advertising. And obviously, as of January 2026, we know that advertising restrictions came into place. However, during the course of our inquiry, we have heard about the issue on brand promotion and that the government have chosen to exclude brand advertising from restrictions. So I would like to start by asking how you justify that decision, given the stated aim of reducing children's exposure to harmful advertising. So, Minister, I don't know if you'd want to start, or your colleagues.
So, it was a manifesto commitment, as you're aware, that we would, restrict junk food advertising targeted at children, which we've done, and we expect that's going to reduce 7.2 billion calories from UK children's diets per year. I hear what you're saying about the brand advertising, because I don't want to give anybody mention a particular brand and then give them some free advertising in this moment, but we can all think of certain brands where you just have to think of the brand and you can think of, it might be different food, a junk food in our head, but you don't need to have had that particular food advertised. So I absolutely
hear what I'm saying.
I do.
Brilliant. So if I can just highlight some Nesta analysis here. That Nesta has argued that industry lobbying has resulted in brand-owned media and brand advertising being removed from the restrictions. Do you accept that industry lobbying has led to this decision?
So, as you know, I'm relatively new to this post, so I don't know. I don't think, from what I've read, I'll bring Natasha in, from what I've read, I don't think anything changed. I think we've clarified the position, is that right?
Would anybody
Natasha?
else like to comment on whether industry lobbying has led to brand advertising being removed?
I think it's probably helpful just to do a bit of the history on this one.
Honestly, we don't have lots of time, so if you could just answer the question, that would be great.
So the short answer is no.
So industry lobbying has not led to brand advertising being removed?
So brand advertising, so no, is the short answer. Okay. During the passage of the original legislation, ministers were clear at the dispatch box that the intention was never to include brand advertising. That is partly because the evidence base there is not as strong as it is for product categories.
So let's look at what Nesta say for this advert for the evidence. So Nesta say that closing these loopholes could lead to 33% of food and drink advertising spend being in scope of regulations, where currently once, unrestricted channels and brand-focused advertising is accounted for, the restrictions will likely cover around 1% of food and drink advertising spend. And let's just be clear about online advertising spend, which has grown from £1.7 million in 2004 to £574 million in 2024. So is it reasonable to suggest that food and drink industry sees a value in advertising and that closing loopholes that could lead to 33% of food and drink advertising spend being in scope of regulations is not necessarily something that industry would be in favour of?
We're obviously following that evidence base as well. I guess the point I'm making is that the original intention of the policy was not to include brand advertising. The reason that we laid the additional legislation to make that clear...
Can I be clear? Why is that? Why was brand advertising out of scope when Nesta clearly demonstrates that food and drink advertising spend would be a third as opposed to 1%? Why was it out of scope?
That was the original decision that was made at the time. The legislation came in back in 2022. What we are doing as part of having implemented that policy is through the post-implementation review, we are actively looking at the implications for branding because there isn't that strong an evidence base. You quote the Nesta stuff, that's exactly what we're following as well. But we are interested in doing our own research into that to see the effect of brand advertising. And at that point, when we've got that strong evidence base, we can look at it again. Excellent. But the decision was made originally.
Lovely. And I should declare at this point, I'm a public health consultant, so my interest is in public health. But the Nesta does go on to say that governments need to balance public health requirements with those of business, but the much amended version of the restrictions appear to strongly favour the latter. Would anybody have any thoughts on whether we're favouring business over public health here? Any thoughts?
I mean, I would just say, Minister, that is a balance that we always have to make in defining the...
But it does look, I mean, Nesta suggests that we're not actually getting the balance correct if the stated aim of reducing children's access to unhealthy advertising is what we're trying to achieve. it would suggest that we're not achieving what we're setting out to achieve.
What we're trying to achieve is banning the advertising of unhealthy products, and we have focused on those products.
Okay.
As I say, we are monitoring the implications on branding. The reason that we laid the legislation was to make that clear, but that was always the policy intent. So it wasn't because industry were lobbying us in order to make that clarification, but the clarification on the policy was already there. So, we knew that was the policy. We tried to then give it legal basis, essentially.
So you say you're monitoring this issue around brand. Bite Back have described the brand exemption as misaligned with the evidence and suggest that it clearly privileges the industry over protecting children's health. At what point will you have sufficient evidence to say whether Bite Back and Nesta are actually describing the case as it is?
So we're looking at it through the post-implementation review. The legislation requires us to do that within 5-year timeframe. But it is worth saying that we obviously do also have a live consultation out there on strengthening the advertising regulations in line with updated dietary advice. So it is not that ministers are not interested in making sure that we are
I'm sure the ministers are very interested, but for the time being, the public still have 1% of the spend on food and drink advertising not coming through to them on advertising, and the brands remain in place. So let's move on to brand-owned advertising. So in June 2021, the Conservative government committed to a 24/7 online advert ban. However, a brand's own direct channels, so website, apps, non-sponsored social media content, including a brand's own accounts, customer emails, SMS, app notifications, who hasn't had those, are no longer in scope of the ban. And the top 10 out-of-home food companies have collectively more than 5 million followers across their UK Instagram and TikTok accounts. So I wonder what, Minister and colleagues, your approach is to reviewing these scope of regulations, including whether exemptions for brand-owned media and digital direct marketing are being used to avoid the restrictions and therefore should be brought into scope.
It's one of the things that our post-implementation review will look at. Obviously, online is a kind of very broad and developing emerging market, so it is something that we are interested in. So it is very difficult to define exactly what brand advertising is.
Just going back to,
we tried to give
I hear you, and you're looking at Nesta research, which is great. Again, I've got the Nesta research here. It found 73% of adults in the UK receive at least one direct message each day, and 64% of direct messages featured either an unhealthy product or came from a brand associated with less healthy food and drink categories.
Is that via social media?
That is through direct messaging. Right. So from a public health point of view, do you think that's acceptable? Or do you think that's something, if our stated aim is to reduce adults and children's access to this unhealthy advertising, that this is something we should wait 5 years for a post-implementation review to look at?
How far through the post-implementation period are we?
Early on, because the advertising regulations came in at the start of this year. I think all I can say is, I share your concerns, and it's something that we're actively looking at. That is partly why we do have an ambitious delivery plan in the 10-year health plan on trying to go as far as we can on childhood obesity from a prevention point of view. This is one of the tools in our toolbox. We've got some others as well. And like I say, we are consulting on strengthening those regulations.
So let's move on to another tool, just because I know time is tight. Let's talk about smarter regulations. So the 10-year health plan proposes moving to smarter regulations. And existing promotion and placement rules could be repealed because of these smarter regulations, which I believe are coming through the Department of Business and Transport. So let's talk about these. Can you explain what smarter regulation looks like in practice, please?
So is that the nutrient profile modelling?
No, smarter regulations.
The line in the 10-year health plan is kind of linked to the kind of world-leading policy that we're on the course of developing and implementing around healthy cell reporting and targets.
Right.
The intention there is that we would require all food businesses across the food industry to report on the healthiness of their sales. That would be kind of stage one, and really to try and drive accountability. And then stage two would be that you would then apply a target to that in order to try and drive that improvement.
Okay,
what we're alluding to in terms of the smarter regulation is the purpose of that reporting and targets policy is that it gives businesses the freedom then to work out themselves how they want to meet that target, rather than prescriptive legislation that tries to do certain things.
Excellent.
However, we we will absolutely follow the evidence. So we will not think about repealing those regulations unless we know that that policy is working.
Yes.
And we are still at the relatively early stage of policy development in terms of that reporting and targets policy.
So
but that is all within our remit. It's not a different
So you'll forgive me
department.
for being slightly cynical about encouraging these people when we've seen what happens in the tobacco industry. But let's have a look. So the Department of Business and Trade describes smarter regulations as only using regulation when necessary, and ensuring its design and use is both proportionate and future-proof. Okay, so let's just check what these are. They state the objectives of smart regulations are to increase the consideration of use of alternatives to regulation, early and more holistic scrutiny of regulatory proposals through consideration of wider impacts beyond direct cost to businesses, and earlier and more consistent evaluation. So let's balance that with what we've got, what we know about the regulations that potentially this replaces. So research analysed 11.6 billion rows of supermarket sales data from the big supermarkets and found a reduction in sales of food and drinks subject to the legislation as a proportion of total food and drink sales equivalent to 2 million fewer in-scope high-fat salt and sugar products sold per day across England, right? And the researchers conclude that it is likely a combination, and it is clear, of those of reformulation and product placement, the regulations. It's clear that without the legislation, neither of these changes would have happened. So why are we thinking about stopping these regulations and going to, frankly, what does not sound like terribly smart regulations? Why are we thinking about that?
So we're not, I guess the first thing to say is we are not thinking about, it's not even on the radar to think about getting rid of these regulations unless we're keeping them, unless we found something that actually did the same thing and met exactly those statistics that you're talking about through different means. Because the purpose of having a target for all food businesses is that they then can use their own innovation to work out how they meet that target. And that might be different things like where products are placed, whether they do it through reformulation. But the point is to put the kind of incentive on them to work out how to do it.
But if those
incentives...
If you know how to do it, and I presume you do, you guys are the... If you know how to do it, why would you not regulate and enforce? And actually the supermarkets we had in front of us, and they said they'd rather have mandatory, they'd rather have a level playing field, because then everybody has a level playing field. Why would you not regulate?
So they also want the reporting and targets policy for exactly that reason. It creates that level playing field. We would not even think about repealing the legislation that we've done that, as you say, tells them how to do it, unless we were confident that the new policy around reporting and targets replace that for the same benefit or more. So there is absolutely no plan to change those regulations without clear evidence that what would replace them, which is also regulation, the Minister is not shying away from regulating in this area,
I'm sure.
Unless it replaced those to the same or more benefit. But if there is an opportunity to kind of bring that all together through a single policy and a single regulation, that therefore does create that balance between public health and business burden, then it's right that we look at that.
Okay, well, we'll wait to see that with interest. Thank you. And finally, I just want to ask you about the healthy food standard. So can you just describe for us here in the committee how the standard is going to operate in practice?
So that's exactly the policy that I've just been talking about. I'm sorry, I referred to it as reporting and targets, because that's the kind of language that we use within.
Can you just explain about the healthy food basket? That would be great in terms of what you're asking the companies to do. So large companies in the food sector will be set a new standard about the average shopping basket of goods.
So I think we might be conflating two different things here. So in terms of what was referred to in the 10-year plan as the healthy food standard, we now refer to that as our reporting and targets policy. What the intention of that policy is that we will create accountability across the whole of the food sector by requiring food businesses to report on the healthiness of their sales. We're at the early stage of policy development. We've run a series of workshops with industry and also a lot of engagement with the NGOs, academics, on exactly what the sort of shape of those metrics should be and what the design of the policy should be. And we will then go out to full public consultation. So that's the stage that we're at, and that's where we're heading.
Okay, and going back to my colleagues' issues around targets, are you considering setting specific mandatory targets for supermarkets around this issue?
So as set out in the 10-year health plan, it's a kind of two-stage process. The first thing that we need to do is get reporting in place so that we can have that accountability across the whole of the sector and know what the numbers are, because one of the big issues, and you'll be well aware of this, Dr. Cooper, is that we don't know the numbers. So that's about getting that level playing field evidence base. Once you've got that and you can work out where people are, you can then set a target which can get incrementally more ambitious. And I think, Alex, you talked about kind of not necessarily incremental change given the stats in this area, but actually in terms of the food environment, sometimes acceptability does take time, and therefore having the ability to kind of incrementally increase the target could actually help us on this journey so that people accept the changes and make those changes to their diet and healthy eating.
And forgive me if I've missed it, lots of reports are published every day, but the department did commit to consult on healthier food targets and reporting and sort of by spring 2026 launch it. We're in June, I don't know if that still counts as spring. Where are we in terms of that timeline?
The consultation closes on the 17th?
So different consultation. We're basically looking to publish that consultation soon.
Okay.
It might be a stretch on spring. But that is our clear intention. We've been doing lots of engagement with when's spring? I've got a few more weeks, haven't I? It's definitely our intention to launch that consultation shortly.
So just to summarise, it's been really interesting hearing what you've had to say, and I do have concerns around the advertising issue and around engaging with industry in a particular way, but I think we're going to come to that anyway. But it sounds like you are, Minister and colleagues, you are keeping a close eye on the evidence and the data as it comes through, and you are willing to review in terms of what is and is not working for advertising. You're keeping a close eye in that digital space, because I think there is absolutely very good evidence to say that our advertising patterns, our home delivery patterns, our social media patterns have changed hugely. Yep. So are you committed to, you said over a 5-year period, but obviously 5 years is a long time
and
in an evolving world.
We will get, interim reports within that period.
So annually there will be reports about the effectiveness
I'm not sure on the exact timeframes, but I think to your general point in terms of us looking at the evidence base and reviewing whether or not we need to do more, that's the entire intention of having an obesity moonshot, that we've got a list of ambitious policies set out, but where we need to go further, that's exactly what our job is to look at.
So if we said, come back in 12 months' time and tell us if the advertising ban has been successful, if you're going to widen it, if mandatory targeting has been successful, if the healthy food standards has worked, if you needed to enlarge those restrictions, would it be reasonable in 12 months' time to come back and have an interim report with some evidence available?
Yes.
I think whether 12 months is reasonable, I think we could see where we were at that point. I guess the linked point to make is that we are not shying away from strengthening these restrictions, and that is why we have a live consultation out on strengthening the advertising and promotion and product placement regulations to make sure that they are in line with the most up-to-date dietary advice. And that shows that we are willing to continue to keep pushing the boundaries. Yeah, and that's very welcome. I suppose from a public health point of view, there's a lot of evidence out there. So, it doesn't necessarily need to be creating evidence in the future. There's been a lot of evidence, as my colleagues have alluded to, around the issues around advertising and healthy foods being available. But thank you. And you would want us to be robust in order to legislate in a way that will, not be challenged.
And if it helps, we've spoken at length, Becky, sort of where I'm coming from on lots of these issues. And on this, I want all three. I want the nutrient profiling modelling, which is the one that's still out for consultation. I want that to go through. I want reporting and mandatory targets as well. I think all three are what we need. And so I'm very clear within the department that that's where my ambition lies. But absolutely, we accept the challenge on everything you've put to us today. So thank you so much for that.
Thank you, Minister. Alex.